Top 10 signs of diabetes? As you can see, it's no secret that diabetes is one of the most common chronic diseases in the world. In fact, it is estimated that over 425 million people are living with this condition. And the worst part about it all, most of these people are not even aware that they have it. So, to help spread awareness, we decided to make a list of the top 10 signs of diabetes that you can see. Make sure to watch until the end so you don't miss anything. Also, stick around to find out what bonus fact we have prepared for you. Oh, and one more thing. We are not doctors. This video is for informative purposes only. Number 1. Fatigue. Fatigue is a common symptom of diabetes because high blood sugar levels can cause people to feel tired and weak. When your body is trying to deal with the excess sugar in your bloodstream, it will divert more energy towards that task, leaving you feeling fatigued. But also, nerve damage caused by diabetes can lead to muscle weakness and tiredness. It's important to note that fatigue alone is not enough to diagnose diabetes. However, if you are feeling consistently tired and you know it is not due to lack of sleep or some other health issue, then it could be a sign that you need to get your blood sugar levels checked. No. 2. Blurred vision. Blurred vision is another common symptom of diabetes. When there is too much sugar in your bloodstream, it can cause the lenses in your eyes to swell up. This swelling can cause the lens to lose its flexibility and ability to focus, resulting in blurred vision. Additionally, high blood sugar levels can also damage the blood vessels in your eyes, which can lead to problems with your vision. If you notice that your vision has become blurry, it is important to seek medical attention right away. Early treatment of diabetic retinopathy, which is a complication of diabetes that affects the blood vessels in your eyes, can prevent vision loss. No. 3. Frequent urination. Frequent urination is a classic sign of diabetes. When there is too much sugar in your bloodstream, your kidneys work overtime to filter and absorb it. However, when they can't keep up, the excess sugar is expelled through urine, taking fluids from your tissues with it. This leads to dehydration and consequently increased thirst and frequent urination. If you are finding yourself taking more trips to the bathroom than usual, especially if it is accompanied by excessive thirst, it may be a sign of diabetes. Number 4. Slow healing cuts and wounds. When you have diabetes, your blood sugar levels are higher than normal. This can cause problems with circulation and nerve function, both of which are essential for wound healing. High blood sugar levels can damage the small blood vessels that supply oxygen and nutrients to your skin cells, which can slow down the healing process. Additionally, diabetes can also cause nerve damage, which can reduce sensation in your feet and lower legs. This means that you may not be able to feel a cut or wound right away, which can delay treatment and contribute to slower healing. On top of that, high blood sugar levels can weaken your immune system, making it harder for your body to fight off infection, which can also complicate the healing process. No. 5. Darkening of the skin. Darkening of the skin is a less common, but still significant sign of diabetes. It happens when there is too much insulin in the bloodstream, which causes the cells to store more sugar, resulting in fat accumulation under the skin. This can cause the skin to darken and thicken in certain areas, such as the armpits, neck, and groin. While darkening of the skin alone is not a definitive sign of diabetes, it should be investigated further, especially if it is accompanied by other symptoms. Number 6. Tingling or pain in hands or feet. If you have diabetes, high blood sugar levels can damage the nerves in your hands and feet. This can cause a variety of unpleasant sensations, such as tingling, burning, numbness, or pain. The damage to the nerves can also make it difficult for you to feel temperature changes or pain, which can lead to complications such as cuts, blisters, or infections. If you experience any of these symptoms, it is important to consult with a healthcare professional, as early intervention can help prevent further nerve damage. Number 7. Fruity breath odor. When you have diabetes, your body breaks down fat for energy instead of carbohydrates due to insulin resistance. This process produces ketones, which are chemicals that can cause the breath to have a fruity odor. This symptom is commonly known as diabetic ketoacidosis, which occurs when there is too much sugar in the blood. The body tries to get rid of the excess sugar by producing more ketones, leading to a buildup in the bloodstream and eventually spilling into the urine. As the ketones leave the body, they produce a distinct fruity smell on the breath. This symptom should not be ignored, as it can be a sign of a serious complication of diabetes known as diabetic coma. No. 8. Yeast infections. Yeast infections are another common symptom of diabetes. When there is too much sugar in your bloodstream, it can create an environment that is more favorable for yeast to grow. This can lead to infections in areas of the body where yeast normally does not grow, such as the vaginal area. For women, this can manifest as a vaginal yeast infection. For men, it can lead to an infection on the genitals or in the urinary tract. Yeast infections are not only uncomfortable, but they can also be a sign of high blood sugar levels. If you are experiencing symptoms of a yeast infection, it is important to consult with a healthcare professional. They can provide treatment options and also help you manage your blood sugar levels. Number 9. Weight loss. Even if you are not dieting and you are still losing weight, it can be a concerning sign of diabetes. When your body cannot properly regulate blood sugar levels, it will start breaking down fat and muscle for energy. This can lead to unintended weight loss. Additionally, people with diabetes often experience increased hunger and frequent urination, which can contribute to weight loss as well. It's important to note that weight loss alone is not a definitive sign of diabetes. However, if you are experiencing unexplained weight loss, especially if it is accompanied by other symptoms, it is important to consult with a healthcare professional. Number 10. Increased thirst. Increased thirst is a common symptom of diabetes. When there's too much sugar in your bloodstream, your kidneys work overtime to filter and absorb it. However, when they can't keep up, the excess sugar is expelled through urine, taking fluids from your tissues with it. This leads to dehydration and consequently increased thirst. Additionally, nerve damage caused by diabetes can also affect your thirst mechanism, leading to an increased sensation of thirst. If you are finding yourself constantly thirsty and drinking large amounts of fluids, it may be a sign of diabetes. And here is the bonus fact that we promised you. Did you know that diabetes can also affect your feet? People with diabetes are at a higher risk of developing foot problems because of poor blood circulation and nerve damage caused by the disease. This can lead to ulcers, infections, and even gangrene, which can be serious and require medical attention. Therefore, it is important for people with diabetes to take good care of their feet by checking them regularly for any signs of injury, keeping them clean and dry, and wearing comfortable shoes that fit well. Thank you for watching. See you next time.